Hey, what's up, my optimal minds? Dr. LeGrand here, and today we're going to be talking about why ADHD supplements don't work for you. And if you are new to this channel, go ahead and hit the subscribe button because every single Thursday at 3 p.m. Pacific Standard Time and 3 p.m. Eastern Standard Time, we do these live streams where I answer your ADHD questions. We do a little bit of training, and at the end, I do ask your questions, so you can put that in the in the chat below, and then we will dive into everything. So let's get right started about, excuse me, about why ADHD supplements aren't working for you. There's 5 big mistakes that I do find that are very typical for people with ADHD, that why supplements just don't work for your ADHD. So let's go over those mistakes. So right into it. The mistake number 1 is, let's just say, if we treated taking medications the same way that we take supplements. So supplements, we go to a store, a supplement store, or we go online and we pick whatever we read online and said, okay, someone told me that this was good, this was good. What if we treated medications the same way? So you went in and you looked at the store and you're like, hey, this is a good option. Why don't we just choose something like this? And the problem with that, of course, is if you were to choose any medication, so that's mixing all the medications, not just ADHD medications, but like things for diabetes, things for high blood pressure, and you're just like, oh, let me just try it. Well, guess what? We would have severe problems if we were to just choose whatever we wanted to on medications. The same kind of applies to supplements. Now, obviously, supplements aren't as dangerous. They're not really dangerous, but again, we're just going in blindly. So that's the mistake number 1 that I see a lot of people do, is they'll just go to a supplement store or online and just choose whatever that they read without any professional advice, without talking to a nutritionist, without talking to a doctor. I know a lot of people say like, well, doctors don't know much about nutrition. Well, you find a doctor that is more holistic mind, that is educated in nutrition and about supplements. You can find multiple, a naturopathic doctor, an osteopathic doctor, a functional medicine doctor, a nutritionist, somebody that is educated about supplements instead of just going into blindly, that knows your medical history and where it makes sense to actually take those supplements. It's the same with medications, it's the same with supplements. You should not just go in and taking something blindly without having some kind of professional advice or someone that actually has done something for you, which leads into my other mistake that most people make. The second mistake is, the problem that I see is taking way too many different supplements at once. And this is a problem, is I've had patients that will come in and they have boxes and boxes of different supplements. And that is a problem, okay? When someone is taking all these different types of supplements, guess what? The body doesn't even know what's working or what's not. You don't even know what's working, what's not, because you've added so many different things, and it's hard to really see which supplement is actually making a difference. And when you add more and more, it just complicates things to really help you to make ADHD supplements really work for your ADHD. Okay, so hopefully that makes sense, is that is a big mistake that a lot of people will do, and I see common all the time, even if it isn't for ADHD, but other health conditions. Now, which leads into my mistake number 3 that I see a lot of people do, which leads into why you should be seeking out some professional that knows your medical history, knows your situation, but can run some testing. This is why, when it comes to even taking medications, usually as doctors, we will run certain tests. Now, I get with ADHD, not a lot of doctors do run tests. They just do an assessment questionnaire, and then we'll use you as a guinea pig to try out different ADHD medications. I personally don't think that's the right way. I think we should be doing questionnaires and doing some additional testing to looking more in depth as if there's other imbalances, because there's several other things that could be going that could cause ADHD symptoms to becoming worse instead of just what's going up here, okay? So what I mean by this is that, you should be doing some blood work, looking at some, mineral deficiencies, vitamin deficiencies. So even if you're looking at zinc, vitamin B, looking at vitamin D, looking at magnesium, these are things that I would still run a test, because then if you run the test, then you know if you need it or not. Then that helps you solidify of really what you're taking to help you be more compliant, because you're like, oh, well, I saw I had a test that was deficient, so it makes sense to take this. And that way your doctor or whoever you're working with a health coach or health provider, can really have a good treatment plan laid out before you. And that's what I do with all my clients and patients when I'm working with them, is we have to run testing first to see where the imbalances are. Looking at amino acids, same thing. When you're taking all these different amino acids that, are nootropics, essentially, you want to run some testing first. Looking at hormones, there's certain hormones that could be impacted for ADHD. But guess what? You want to make sure that you run some hormones to see if it makes sense to take certain supplements that help improve those things. Give me a second here. My mouth is getting a little dry. All right, we got Rusty here. We got Vicky here. Welcome, everybody. Yeah, go ahead and put your questions in the box, and I will answer those towards the end. And once I'm done with the training, and just let me know where you guys are coming from. So that is mistake number 3, is you got to run some testing, and that is really critical when it comes to making ADHD supplements work for you, because if you have no idea what's wrong, what is deficient, then how do you know what to take, right? I mean, you can guess. You can kind of say, okay, maybe this might work or this might work, and it doesn't quite hurt. It doesn't really hurt, really, because supplements are nutrients. It's something that we also get mostly in our diet. But to really make it work for you, for your ADHD, you got to run some testing first, okay? That is mistake number 3. Now, leading to mistake number 4. Now, after you've gotten, the right types of supplements, you've run the testing, you had a professional look at it, what you need to be doing next is giving it some time, okay? So time is important. Yeah, sorry about that. I don't know. Time. So giving it some time, because usually with supplements, it takes a little longer than your medications. Medications, you'll feel that instantly because it's very high dose. It's more concentrated, where supplements is something that our body recognizes, and it just takes time to be able to adjust to that. So what you have to do is, what is the time frame? Well, I say, anywhere from 2 to 3 months. Some people a little less, some people a little longer, but usually generally about 2 to 3 months, especially for me when I'm working with patients and clients. If we are implementing something and we're seeing a difference within that time frame, we're going to, guess what? We're going to switch out supplements. We're going to switch out different treatment plans and strategies, because if it isn't working, especially if you've been consistent, that's the other mistake that a lot of people don't do, is being consistent. Okay, you got to be consistent. Taking it daily to making it effective. If you're not consistent, if you're really spotty, it's like, oh, I missed a couple days and I did it this day, but not this day. You got to be consistent. So consistent for 2 to 3 months to see if there is a difference with the supplement. If it isn't, then guess what? Maybe try something different. Okay. Which leads into the 5th mistake that I see a lot of people don't do. And that is retesting. Okay. You got to retest the lab. So after you've been consistent taking the supplements for 2 to 3 months, then you retest. Sometimes some tests, it might take, 6 months to a year, depending on the test. But a lot of them, you get to retest in 3 months. Some of you retest monthly to kind of see, okay, has those numbers improved? Have my, test results really improved? Has my biochemistry improved? Have my symptoms improved? Is my ADHD better? Is my mood better? Is my focus better? That is where you are assessing again what you're taking. Is it making a difference? The same goes with medications as well. I mean, you want to make sure that you're working with your doctor, see, like, is it making improvements? Do I need to change the different medication? Do I need to change the dosages? And this is why retesting is so critical for any health condition, but especially for ADHD. And that's what I do, is like, we got to look, okay, I want to know what is working and what's not working. I don't want, my patients or clients to be taking something that's clearly not doing much for their body chemistry, and it's not clearly improving their focus or attention or their mood or their energy or their anxiety or depression, whatever it is. You want to make sure what you're taking is adequate, because you don't want to be taking something that could be even damaging to the body. So that's why retesting is so critical. And I understand that, a lot of this, it takes time to really understand what can work and what doesn't work, and maybe finding a doctor that actually is going to do this process with you. And so I have a free guide in the description below that you can download. And it basically goes over the labs that you should be talking to your doctor about what you should be taking or getting tested for. It also has a list of supplements and foods that you should be doing for your ADHD. So it's a free ADHD guide in the description below. And if you're new to this channel, subscribe to this channel. Every Thursday we do these live streams, and we're going to jump into Q&A here in a second. And then also every Monday, I do upload a new ADHD video on lots of different ADHD health tips. So thank you guys for attending and watching, and I'll see you guys in the next live stream. Thanks.